of these recommendations and the slide that Michael was speaking from, there's links, and you can go into much more detail. So what is an audit? What does an audit entail? Why an audit? All of those things. So that's, because it's a lot, especially when people haven't done it before. So first one, citywide department level equity audit. Again, click those links and it will detail. Public declaration and strategic actions. This goes right along with what you have already done and kind of adds to that. Is that your alarm? Time for Q&A. To commit to policy change, again, you've done a lot of that with the declaration and with the ad hoc committee. The ad hoc committee shifting over to a council, just so this work, can be done in a lot of ways and help to be kind of streamed along. Analyzing all policy and legislation through a racial equity lens. Again, that's linked up to city recommendations, municipality recommendations across the country. And what equity lens is really asking who is negatively impacted by this policy, who is involved at deciding the goals and parameters, essentially who's at the table, who's not, who's been left out, which systems will implement the policy and who will have access to these systems, both physically and socially, and what policies, what does the data tell us about past inequities? And this is a racial equity lens, not just for the health department, but for all of the decisions that you make. And honestly, being reminded of these helps us kind of take an equity lens, because what we have seen with the data is that disproportional groups are impacted differently by different characteristics, such as race, socioeconomic status, and the like. So the next one there is then all members of council attend a racial wealth gap simulation before the end of 2024. Kim has been fantastic. Miss Kim, she actually came to my class and performed it for my class last week. She was at my class. The racial wealth gap simulation is an incredible opportunity for us to see exactly how social policy and health policy are intricately linked in how it produces the wealth gap that we continue to see today. Pass it on to Jeff.
Great, thank you.
Sure. Jeff, do you want to run through these ones? Or do you want me to go through these ones?
It's okay.
I don't know time. Me? Go? All right, so 7 through 13. I'll do it that way. 7 through 13. A lot of these will come directly from an equity audit. One of the things that Michael didn't touch upon, and I'm hopeful to welcome questions, is an equity audit is a chance for you to show off what you're doing well. There's a methodology called appreciative inquiry. It's this idea that we're going to use data to drive decision, which everybody is likely to be on board for that. Because if we continue to make decisions without data, we are not making the right decisions. An equity audit is giving you the tools to make the most efficient, cost-effective, inclusive decisions possible. So transparency and decision making. Residents, the recycling bin, I think, has been an issue that you're familiar with and that has come up. Who is getting it, who is not? Is it equitably distributed? All residents, again, there's the trash bins and the recycle bins. Reconsidering tax abatements, the but-for be included in those applications. Hiring a diverse staff in leadership positions. Again, focusing on changing organizational culture to be inclusive and collaborative, and broadening the vendor pool. And I kind of want a preemptive question that I think might come is, how is these social policy recommendations health policy? Because social policy is health policy. And as we continue to implement policy and practice that is inequitable, we are disproportionately giving baggage to some groups while alleviating that for others. And so it is a systemic, it is a network, it is not always individual behaviors. It's systemic, and because it's systemic, to solve those problems, we need to look at social policy as health policy.
Okay, great.
Okay, and now
Thank you so much, yeah. So this is the time we're opening up for questions and comments from council.
Mr. Chairman, I have a question. In keeping with the public health theme, you remember Annette Funicello, the original Musketeer?
Yes.
She was Italian-American descent, and her untimely demise was some kind of weirdo disease that was prevalent in Mediterranean-based people. And what I want to comment on what this guy said. If people of color have diabetes, I mean, is that just like a genetic thing, or I mean, I don't know how like those types of diseases can be characterized by racism. I'm not understanding that. I mean,
Michael, I'm feeling this one.
Certainly,
I'm diabetic.
and I am too.
Okay.
So I type 2 age
A lot
onset.
of people are.
Yeah.
But part of it obviously is genetic, but part of it is also lifestyle and diet for some people. In other words, if you eat the wrong foods, if you just don't get the exercise, you're more likely to get diabetes. And if you look at as Jessica referred, the data, it's not equally distributed across all ethnic groups. Actually, in the United States, it's Native American population that has the highest amount of diabetes. So, it doesn't automatically conclude that genetics doesn't have a major role, but there are other things that could be socially determined that could change.
Can I,
Access to fresh food and.
sorry,
yeah.
can you go back to the slide and let Jeff, go ahead, Jeff.
Well, yeah, Jeff, go ahead and then
Go
I'll
to
back
the slide with Liam on it, I think.
Which one?
The one with Liam, go all the way back. And Jeff, go ahead, you can answer that while she's going back.
Oh, no, I was just gonna say, some things like that, right? Like, does this neighborhood or this place have the same access to things that provide them with that, the ability to have a healthy lifestyle with other people? Jobs, the type of housing, right? Like, disproportionately, right across the country, there are folks of color often are living in houses that have lead paint in them, which has negative health effects, right? Like, there are lots of different factors, right? These are complex issues that have a complexity sometimes of factors that are influencing them. So by trying to have an understanding through a data kind of audit, trying to figure out through discussions of staff and external parties, you can figure out what some of those things are. Because if you can move the needle on even just a part of that complex thing and expand or advance someone's life expectancy or lower the diabetes rate by percentages, that's a huge thing, right?
But do you think society in general can force people to eat right?
So
I know.
I'm gonna, don't get sidetracked. I'm gonna go right on this one. So one of the things, and the reason I posted this slide for you and the link, so the Health Equity Ashtabula, that's another link that's gonna take you to the handout that we had that evening. So that evening, we watched a documentary on the social determinants of health, and it really goes into depth about what are the social determinants of health. Essentially, health is more than healthcare. We've seen that everybody has healthcare, but people are still sick, right? Health is tied to the distribution of resources, which my colleagues talked about. Here's the thing about racism, right? Racism imposes an additional burden. And that additional burden was very clear in the film. And one of the things that I think was the most eye-opening for me was the impact of chronic stress. The impact of chronic stress, including racism and what it does to our bodies. And so you can see within our bodies, the accumulation of stress through cortisol, the accumulation of stress in the cortisol chemical. What's interesting about this is there was the film, and I think this was good, looks at macaque monkeys, all right? And the study looks at macaque monkeys that are in dominant and subordinate positions and then does a side view of their arteries. Which macaque monkeys have, now their diets are the same, their environment's the same, the only thing is the stress response. One monkey is under constant stress while another has the control, okay? So this is the macaque monkey study. It's linked up to the film. It's a great film, but it shows that chronic stress is deadly for us. And so the ad hoc committee is not an ad hoc committee on racism. It's an ad hoc committee on racism as a public health crisis. So I feel like that has already been determined, right? We know that racism is an additional burden. Can you fast forward to the next couple slides? The one thing that GIS specialist, who happens to also be my son, he put this together for us because what it shows is different census tracts have different cumulative disadvantage, right? So we're talking cumulative disadvantage. Maybe they're not making the right choices, but maybe they don't have any of the right choices to make. So some of us can go and afford to buy produce. Others have to make the decision. We know that because of subsidies, some products are less expensive than others. So it may look like a bad decision, but it may be what we can afford and have access to. Again, the film was really great at laying that out. But what you see in your own city here is a disproportionate impact of not just racism, social economic status, all of these things are cumulative, leading people to live 10 years less than their neighbors. That's something that needs to be addressed, and it can be addressed by social policy. There's ample evidence. If you go into the slides, if you can just scroll through, there's links to more documentation on all of this. So this health policy being beyond our own decisions is linked up there. The film is linked up there. All of the maps and the data from the maps are. All an equity audit's gonna do for you is going to determine what data tells you. That's it. Your departments are gonna make decisions. You're going to be responsible in the sense of the departments will say, hey, this is a goal we have. Look at what we're doing great. It's not to demean, devalue, to pick apart, to say you're doing something wrong. It's actually very much the opposite. What are you doing right? So we can amplify it, and then we can also make all of those decisions based upon data.
Thank you.
Thank you.
Can I ask,
Sorry, I went in my
you
teacher
gonna ask
mode.
something else too?
No, I understand. I go along with that stress thing. I can see that being on.
Yeah.
Kelly, can I ask you, because it seems the court is doing some of this. So when
Yeah.
you get your report at the juvenile court, maybe you could tell us, what does that look like? We incarcerated 100 people, this many minorities, this many, this many blacks, this many Latinas, this many whites. For this, is that what kind of information that you're getting at the court?
Yes.
Okay,
Yeah, we receive data on the date of the arrest. We don't get it by location though, like it may be, it's directly from Ashtabula Police Department,
okay.
but it's by gender, race, offense. It says incarcerated, but we don't incarcerate everybody.
Judge
So
did
we
away
have
with
6
that.
beds in Trumbull, Mahoney.
Yeah,
The kids that are there need to be there for public safety.
right, yeah.
The other kids or delinquent offenses, unruly offenses.
So I guess, in like you said, you mentioned you got a report from Ashtabula City Police Department one time. What did that, what kind of information did they share with you?
It just shared the offense date, and it didn't match. I already collect all that data.
Yeah,
I collect data on every youth that we get brought in anywhere in the county, by police department,
okay,
by race, gender, age. We do a risk score, we do whether they're handcuffed, so we're collecting all of that data.
okay,
So, but Ashtabula is, police department is our biggest feeder.
okay.
That's one of the reasons that we're here participating, so.
So it would tell you, Ashtabula Police Department, we arrested, 7 black children, 2 Latino children,
Yes,
8 or 10 white. It would show you all that kind of stuff.
yes, by gender too.
Ms. Butcher, does it also show you which students were handcuffed and which ones weren't? Right. And from my understanding, you all are asking for this information from the police department because you're starting to see disproportionate rates in children being, what's the word, brought in, and you're starting to see the gap between students who are entering into our juvenile justice system at a young age. So you're asking for data so we can begin to look at that and make informed decisions about how can we prevent that pattern from continuing.
I have a question. And maybe this is part of what you're already doing, but I'm a firm believer that knowledge is power. So I just feel at young ages to get kids on the right track for education and future education is really important. I think with education comes opportunities. So is that, how is that in your program?
Education.
Mm-hmm.
We provide evidence-based programming, so we do a girls' circle and a boys' council group, which are evidence-based, they're self-esteem building groups. We also do a parent project group for parents of youth who are constantly truant from school. So when we see youth that come in specifically for truancy offenses, we go through a whole process of assessment tools and family needs assessments, determine what's going on in the home, so we can make sure there's no need, that we can't fill. Whatever agency we're able to fill that need, so there's no more excuse or reason as to why those kids cannot be in school. Educationally, we're providing a lot, we have pro-social funds, so we're helping kids and families get YMCA memberships, horseback riding lessons. We helped a
So, and also, I guess what I didn't relate was as for vocational training, whether that would be college or one of the trade skills. Are there programs in place to help someone who's graduating from high school to go on for future learning?
We refer a great deal to youth opportunities here in our county. They provide a great deal of educational training, whether it's GED, they offer summer programming, they offer classes, tutoring. So they're probably our biggest referral for youth for education purposes if they're not in school. So, and then ATEC, we try and steer youth to ATEC or youth opportunities.
Thank you.
Mr. President, I know we're nearing time.
Yeah, we're over
So I would
time.
just like to say that, one, thank you all for again creating the time, and thank you Equity Champions for being here and sharing your results of our exploration. And I want to say that we likely have the most diverse city council since its inception. I don't have any data to prove it, but that's just what I'm thinking. And while that's good news, we still have a ways to go beyond who is currently on council. Not only should our leadership reflect the demographic makeup of our city, but our municipalities should as well. The contents of this presentation is important, it's timely, and I hope that we will continue so that we are more intentional about disrupting the social determinants so that we reduce the impact that racism has on individuals and in our city. Racism is real and everyone is negatively impacted by it, some more than others. Council, I hope that we can encourage you to take a closer look at what's been presented to you, and so that you can help us determine what next steps we need to make an impact and make Ashtabula healthier.
Okay, thank you. Thank you, Ms. Holman. And again, thank you for the committee for coming. We have a lot of information to look at and to study and to digest, and we will, yes.
Any question on how to access it? Because I would like to address like any of those questions if anybody's unable to
Yeah.
access the things that are linked up, because those things are linked up and they're important, but I want to
Okay.
make sure you have access.
Has anybody been able to,
Okay.
and if, yeah.
So as a follow-up, Mr. President, what is council's wishes for next steps?
Well, I'm not sure. I think council will take some time and have to look at all this information, and then we'll see where we're gonna go from there. We'll have a discussion. I believe we'll have to get together as a council, maybe if we have time to digest this, because there is a lot of information, and I'm sure there's still a lot of questions. So we'll get together and to see where we want to go next. But we understand your presentation, we appreciate, and we understand that, I think I get the impression that we need to do something, to keep, I don't want to say keep the ball rolling, but to keep things moving along with your committee, to go from there, so. Yeah, I don't know, I can never give a timeline. It's hard to do. We have our budget coming up next month in November, and we do that in December. And so there's always something, when you do government, but we will make time for it, I'm sure, and give it some attention. Thank you for all coming. We appreciate it. It's a lot of information. It's an interesting topic and one that certainly needs our attention. As Mike said, it's going on all over the country. In Ashtabula, I like to think Ashtabula City, we're the leadership in the county. I like to think we are, so we will go from there.
Just in case you want, there's a few, these are some of the things, documents that are linked up. So I just gave him some of my copies that are
Okay, yeah,
not
then,
pretty, but they're linked up. That's not the ones.
and he'll pass them on.
That way, if you
All right. Thank you. So we're going to go on to our regular meeting. You're welcome to stay. Jeff, I don't know if you want to stay. You're good?